Every child in every family deserves the best start in life, deserves to grow up healthy and well-adjusted and fulfill his or her potential. And in my work, I see so many children who don't have that chance. For one reason or another, there are barriers to them fulfilling their potential. In Australia, we know that more than 1 in 5 children start school developmentally vulnerable or at risk. And we expect schools to compensate for what's happened in those years before a child starts school. And that's a very strong case then for increased investment in the early years, because we know that children who grow up in environments that are stimulating, that are rich in language, where concerns are addressed early on, are much more likely to arrive at school ready to learn. We also know that in Australia, about 1 in 6 children have an identifiable mental health problem. And there'll never, ever be enough psychologists and paediatricians and psychiatrists to treat these children. So in consultation with the teachers themselves, with principals, with the schools, we developed a program that we've called the Mental Health in Primary Schools program, or we call it MIPS for short, where we train an experienced teacher to go into primary schools in a new role that we call the Mental Health and Wellbeing Coordinator. This is not a clinical role, but given their training, they go back into the schools and they work with classroom teachers to help them identify those kids that are struggling and do something about it. They develop a whole of school approach that builds resilience, which is so important for young children. And importantly, they act as a conduit or a liaison between the school and community agencies for those children with complex issues that need a more comprehensive assessment. So part of the goal of the MIPS program is to begin to move the discourse away from treating established mental health problems towards prevention and early intervention. We know there's stigma attached to a mental health diagnosis. We know that many parents are reluctant to get help because of that stigma. We want all children obviously to have good mental health, but inevitably almost every child as he or she goes through life is going to face some hiccups. And our goal is to identify those children who are starting to struggle as soon as they start to struggle and build scaffolding and supports around them to stop them becoming overwhelmed and needing to go to mental health professionals. If we have healthy children, we have healthy societies. And it's like building social infrastructure. We talk a lot in this country about building physical infrastructure, bridges and roads and electricity grids. We don't talk nearly as much about building social structure, and yet I would argue that in the end, that's equally as important as healthy young children grow up to be healthy, well-adjusted adults. The good news is that we know what to do to make children's lives healthier. The research is pretty clear about what young children need to thrive and prosper. It's also clear that intervening early makes a difference. We need to focus on the health and development of all children because we know that healthy children have every chance of growing up to be healthy adults.